Hi folks, today is Tuesday, June 9th, and a few updates for you. First of all, we let you know last week that we had an independent living resident at our Birch Hill campus test positive for the COVID-19 virus. Since then, we have tested 100% of our independent living staff at Birch Hill, and they have all tested negative. And we have tested our independent living residents. We did have a few independent living residents who chose not to test, and they're self-quarantining for 14 days. But of the 117 people who did test, we've gotten results back for 113 of them, all negative. And for the 4 that we have not received results back yet, there's a paperwork snafu with the testing agent, so we expect those results back in the next day or so. We don't anticipate any positives. So that leads to the question of, how did this person contract the virus? And while we do contact tracing and we do our own evaluative methods, the reality is we may never know. But what we can do, so we may never know that, but what we do know and what we can do, we can wash our hands. We can maintain a 6-foot distance between us and other people. We can do everything we can to stay away from people we don't know and we don't know how they've been operating. And we can wear a mask when we're in public, and we can wear a mask when we're around one another and unable to keep a 6-foot distance. So those are the sort of the affirmative actions we can take. I'm just going to keep saying them until there's a vaccine, because that's the one thing, or they are the few things that we do know can be helpful. The other thing about testing, the state has started surveillance testing for healthcare. So we've had additional testing done for our healthcare staff at RiverWoods Exeter, and a 10% portion of our health center residents at RiverWoods Exeter. We've submitted those tests. We've not gotten results back yet. And we expect that we'll go through another round of that with Birch Hill in the next few days. So that will be an ongoing thing where the state will test our healthcare staff and test a 10% of our healthcare residents at any given time. So we look forward to that. Knowing is better than not knowing, and it allows us to just sort of stay on top of that. The last thing I would let you know is look for, in the next day or two, so either Wednesday or Thursday, look for an updated chart. Some of you have asked additional questions about the new guidelines, the June guidelines. Turns out the F in frequently asked questions really does stand for frequently. We've gotten a number of questions that are pretty specific, but also they help us think things through at another level of detail. As you think about how these guidelines impact you and relate to you, you're asking us questions. The executive directors and I talk about those with Cindy Martin, who's our VP of Quality, and we'll just keep adding more detail. Expect that these guidelines will be in place at least through the end of June. We want to keep an eye on case counts. It looks like Manchester has about the same number of cases per day that stand steady, not going up, not going down. Rockingham County and Strafford County are steady and pretty low. But we do want to watch what happens now that the beaches are more open. Then the good news is that in New Hampshire, the percentage of cases that are resolving is increasing, and that's up to about 67% of the total cases have resolved. So that's good news, and we want to see what happens over the course of the next few weeks with the beaches open, with visitors in Rockingham County, what happens in Manchester if that starts to see a decline in new cases. We will continue to track all of the data. We'll continue to try to make the right decisions for you in terms of balancing a need for life and a need for some quality of life and some freedoms and interaction, and also a need for risk avoidance and safety for you and for your neighbors. So that's all for today. Please stay 6 feet apart, wear your mask, wash your hands, don't touch your face, and maintain some patience. Thanks.